All right. So can everybody see my screen okay, Lindsay? Got a thumbs up from you if you can see my screen. I'm sharing right now. No? Okay. Let me go to share my screen. Where is my share my screen? For reals here. Oh, duh. All right. Now you should be able to see my screen. Is that okay? Great. So, welcome again, everybody. We are recording this so we can go ahead and put this on our YouTube channel so you guys can go back and look at this as you wish. And I also will be entering a document, a training document or a helpful document in the chat a little bit later today. But we want to do this really casually. We want to be able to have a discussion, answer any questions that you might have as we go through these things. And as we get ready to do that, I can't see you and present at the same time. So, Lindsay, I am going to ask you to kind of help me out a little bit and let me know if there is anything that comes up in the chat or anything that I need to know about as we go through. And Lindsay, if you wouldn't mind taking yourself off of mute really quick, I just want to make sure that you can see my screen. My PowerPoint is visible. Okay, cool.
Yep, you're good, and I can help with anything that comes up in the chat.
All right, awesome, you guys. Thank you so much. Like I said, I can't always see you all and present at the same time and run the chat and all the fun stuff. But what we want to talk about today are ways that we can assess our community. So, one of the things that's different this year is the community services program at the Department of Health, our state office, has generously given us a opportunity to put our community needs assessments on hold for a little bit while they restructure the entire system of how we're going to go collect information about our community. So the CSBG Act requires by law that we have a community needs assessment done every 3 years. And some of you are coming up on having a community needs assessment that might be out of date. And since it's out of date, you might not have all of the information that you're looking for as we get ready to start planning on how we're going to deploy resources a little bit down the road. So as we get ready to do that, there are a couple of things that we want to talk about. First of all, we want to talk about why are we even doing needs assessments in the first place? What it means to organizational standards in our agency as we're doing community needs assessments, and then what the heck are we even going to do with that information once we have it? We're then going to go into showing you guys different ways that you can gather information about the community you're serving and walk you through all of those resources. So, as I mentioned, some of your agencies, some of your counties just don't have access to the community needs assessment or the most updated information that you need. COVID kind of put a wrench in all of the stuff that we were doing in understanding what our community needs. And as I mentioned, the CSP office is like, hey, look, time out. We recognize the challenges that you all are having around community needs assessments. So we're going to go back and we're going to review this. We're going to take a look at how we can make this community needs assessment process easier, more timely, more efficient, and more effective for you as you start gathering that information. So they've put a hold on those community needs assessments that are mandatory by law to have done in your community, which is great when we have that opportunity to kind of revisit what's the best way of doing that. However, community needs assessments are required by part of our organizational standards. And organizational standards and meeting organizational standards for eligible entities is coming up in December. So how do we do both? How do we not, move forward with CNAs? How do we plan accordingly? And how do we meet those organizational standards? Well, with the first part, organizational standards, the state office has given us a pass. So if you are one of those eligible entities, a public or private eligible entity who has a community needs assessment that is out of date or is older than what you need, they are saying, you know what, that's okay. You're going to go ahead and have those met anyways. So I wanted to just tell you really quickly, though, why it's important that we have these things. The organization or the department has organizational standards because that helps us become strong, high performing agencies. And part of those organizational standards is that we have the opportunity to plan, that we know what our community needs. So we look at organizational standard 1.2, 2.3, 3.1, 3.2 through 3.4, 3.5, and a couple other different ways. So let's just go over these really quickly. 1.2 tells us that the organization or department has information that it can analyze and be collected directly from low-income individuals as part of that community assessment. 2.3 tells us, and this is both for public and privates, 2.3 tells us that the organization or department communicates its activities and its results to the community. 3.1 says that the organization or department conducted a community needs assessment and issued a report within the past 3 years. For publics, that department either conducted or was engaged in a community assessment and issued a report within the past 3 years if no other report exists. 3.2, 3.3, and 3.4 are of the following. As part of our community or department assessment, the organization collects and includes current data specific to poverty and its prevalence related to gender, age, race, ethnicity for the service areas. We also have to collect and analyze data on the geographic service area through qualitative and quantitative data in our assessment. And we also have to include key findings on the causes and conditions of poverty and the needs of the communities assessed. And then finally, both public and private agencies are required to have their governing board or their tripartite board formally accept that community needs assessment. So in these standards throughout the network, we're going to see many, many different ways that we're required to use community needs assessments to meet those org standards. But a community needs assessment is much, much more. It really helps us to understand what is happening in our communities, right? It helps us to understand what the CSBG Act, the federal office, and the state office all want in terms of grant compliance. A community assessment or needs assessment can tell us so much more and help us understand our communities, the people who call it home, and what's available, and maybe even more importantly, what's not available in our communities. So no matter how we defined our community, we need to have data to understand it. So when we talk about ROMA, or Results-Oriented Management Accountability Performance Management Framework, we look at taking our first phase, which is assessing everything we need to know about our communities. Who lives there? Who calls it home? How many people identify as being unhoused? How many people identify as experiencing poverty? How many people identify as being food insecure? Not only that, but where do they live? What are their barriers to getting to work, to school, to healthcare? Are there transportation needs that are missing? Are there workforce development opportunities that they have access to? All of those things are so important for us to know before we can go out and offer services. So I tell this story a lot, and many of you have heard this story before, but in an experience that I had around a community needs assessment in Sheridan County about 10 years ago, we surveyed two groups of people. The first group were agencies who were providing services to individuals in our community who had identified as being low income. The second group of people that we surveyed were those people who were actually experiencing poverty. So two groups of people, the providers and the recipients of services. And when we got the community needs assessment back, when we asked both groups, what is the number one thing that people need to move out of poverty? The providers said, you know what, all they need some budgeting classes. If they just had some budgeting classes, we could help them move out of poverty. Okay, that's an assumption that people had about how people moved out of poverty. When we asked that same question for those people with lived experience, our answer was so much different. Their answer was, you know what we really need? We really need dental assistance. And we're like, dental assistance, where did that come from? That seems oddly specific. And it was specific because once we started talking to those individuals who had life experience or were experiencing poverty, they were like, you know what? Dental pain and dental care is something that impacts almost every aspect of our lives. Many of them reported that they had minimum wage jobs that didn't offer sick leave. They didn't have sick days or personal days that they could take off. And so when they were experiencing dental pain, they either had to call in for work, not get paid for that day, or they would go to work sick. When they were going to work sick, they might not have had anybody to watch their children or any of those things. So if they called out sick and they didn't get paid, they were also at risk of losing their jobs. So they were kind of in this, I am in so much pain, I cannot work. But if I don't work, I'm not going to get paid and I'm going to lose the only job that I have right now. We also know about dental is that the infections that can occur in people's mouths can impact their general health, right? It impacts health outcomes. It can lead to blood infections. It can lead to heart disease. It can lead to other chronic infections that can keep people or take people out of the workforce for long, long periods of time. And when we found out and we asked these individuals even more questions, they were like, look, man, if I go to Medicaid and that's my only insurance option that I have, Medicaid doesn't offer dental prevention. It only offers extractions. So now, not only am I getting dental work done, now I have no teeth. And that impacts my ability to work in the public. It impacts my confidence level in order to be able to achieve more as we go along. So this was an outcome of a needs assessment that we did not know in our community until we used maximum feasible participation, or asking those with lived experience, what do you need to move forward? We have our assumptions, but we need to really hear from the people that we're providing services for. What is needed? What works? What doesn't work? And what are some of the barriers that we might be putting in place to keep your family or yourself from moving forward economically? So that's one of the reasons why we assess our communities. We have to identify what is actually needed, and that will help us prioritize. We also want to take from our community needs assessment is what I know about my community, is that accurate? Are there other services or organizations or resources that are available that I don't know about? Or importantly as well, what I don't know about, what's missing, what is not available in our community. So when we start talking about the needs in our community and we start using words like lack of or no access to, that tells us that the community itself is lacking the necessary resources for families to thrive. It can help us make a plan, right? We don't have unlimited money. We only have so much money. So we have to know what is the most effective, efficient way that we can use our resources and deploy those resources for the most bang for our buck in the communities. And so knowing what our communities offer, super important for us being successful in being able to provide those services. So when we get our needs assessment, we start looking at the data. There are going to be some questions that are raised as we learn about our communities and the people who live there. And these questions that you see on the slide right now are really good reasons, again, why we look at our communities. And many times this is where our board or our agency staff or our senior leadership really takes a look at understanding the context. We're doing an analysis to understand the context of where our opportunities and our threats are developing over the next year. What do we need to know? What's coming down the pike? We should have already done a review of our agency mission and have a pretty good understanding of what the board assumes about poverty and its role in addressing poverty. If we haven't had those discussions already with senior leadership on our board, it's time to have those, right? What does our board believe is our job in addressing the causes and concerns of poverty? If we don't have that understanding, a lot of the data or the analysis or the assessment information that we're bringing in might be out of context. We don't really understand how we want to address that. So some of the things that we want to know are, where are our low-income people living? Are there particular pockets in our community that make it difficult for individuals to access food or quality childcare or transportation? What is that highest need that was identified in our assessment? As I mentioned in the Sheridan one, it's like we thought it was we just needed to show classes on budgeting, and we learned, hey, no, we really need to start finding ways to address dental issues that people have in our community. We also want to know where our gaps are, right? So if we're looking at data that says, hey, this is weird, we've got 25% of our population does not have access or is not signed up for SNAP benefits. Out of that 25% of our population, 3% are actually signed up for SNAP benefits. That tells our agency that there is a gap somewhere. There's something that needs to be addressed, and that will help us inform our services moving forward. Do we need to start having SNAP applications at every desk? Do we need to make sure that we're helping individuals apply for SNAP, for WIC, for free and reduced lunches? Maybe there's a situation where we just don't have enough jobs in our community that pay a living wage. How are we going to address that at an agency level? What is our demographic breakdown? Is our community skewing older or are they skewing younger? In Wyoming, our population tends to skew a little bit older, and that might be looking at how we're changing how we provide our services. If we're looking at food insecurity and over 50% of our population is over the age of 65 and is disabled, maybe we need to take a look at congregate meals or meal delivery programs or services to that population. That's why it's important for us to know, what are the ages of the people that live here? What's the population? If we have a community that is 75% identified male, only offering services around OBGYN may not be the greatest deployment of our resources or the greatest use of our resources. We need to know who is living in our community. And we also need to know what our agency is doing, right? So we take our data every day from our reports, from our intake information. And we compare that to what our community assessment is telling us. So, for example, if our community assessment is telling us, look, we have a very large segment of the population that are both veterans and disabled and in low income, we want to take a look at our agency information. Are we serving any of those individuals? If there is a huge discrepancy or a wide variance of that, that's another question we want to ask ourselves. Are we serving the population most in need with the limited resources we have available to them? And then we want to talk about, are our assumptions accurate? Again, I'm going to go back to that Sheridan needs assessment, right? We made the assumption that if they only had budgeting classes, we could help these individuals move forward economically. Our assumptions about people living in poverty or experiencing poverty were completely off. They just weren't a correct assumption. So those are times when we get to reflect upon ourselves through our staff, our senior leadership, and from our board. Are we making the appropriate and correct assumptions about our community? So now why do we even really need to know this stuff, right? We need to be able to do a couple of different things here. We already talked about a couple of reasons and a couple of questions that should be raised or that we're asking about ourselves, but we also want to know about our community so we can better share our story and our impact. And why is this important? Well, because numbers and stories help keep poverty issues on the radar of our community. Our leaders and those who are experiencing poverty can feel that they and their experiences are being seen. We can also use and communicate these opportunities with different stakeholders to explain the mission of our agencies and let everyone know about the services that we provide. When we look at our anti-poverty agenda, we can bring other segments of the population together around the needs assessment to build consensus on broader poverty related agendas. And finally, don't ever underestimate your ability to fundraise for your agency and for lay the groundwork for long-term support for your agency. If we're going to go to our philanthropists, if we're going to go to our foundations, if we're going to go to our banks and we're going to ask for money, we need to tell them what's going on. We understand our community, and this is how we're going to address these issues. And here's how you can help us address these issues. So before I go on, I'm going to come back to you guys really quickly, and I want to open up the room to anybody who might have any questions, comments, or pushback, or any feedback about what we've talked about community needs assessments this far.
And I would just, in addition to what you have been saying, this can also be a tool to show where your successes are or the difference that you have made. And you can never underestimate the power of storytelling when it comes to fundraising and community awareness and all of that as well.
Thank you, Lindsay. That is absolutely true. Storytelling is at the heart of what we do. It is for all of us to be able to say, this is the difference that we're making. And we talk about this in Roma all the time, right? It's not enough for us just to count the number or the pounds of food that are walking out the door. We want to talk about the change that is occurring in our community. And when we talk about ways that we're going to address poverty, the causes and concerns of poverty in our communities, we need to understand how we're going to deploy those resources. Are we only going to do emergency resources on a one-time basis for individuals in our community? Or are we going to go into intentional, intensive case management that really works with the breadth, the depth of poverty in our communities? Both are valid service provision models, right? Some people just need that one-time assistance to keep them out of crisis. other people are looking at years and generations and years and years and years of generational poverty that's going to take a lot more than a rent payment for them to find their way out of poverty. So when we knowing our communities and what type of crisis is happening, it helps us understand better about how we're going to deploy those resources. Does anybody have when was the last time, Sherry, Crystal, anybody answer as you guys feel, when was the last time you took a look at the needs assessment that you had done for your community? Anybody want to share?
It's been a minute since I looked at mine, but we are doing, and no, and I mean, you want honesty. However, when they first come out, I definitely look at them. I don't think right now any of the things addressed on our last needs assessment have changed. However, we're doing two new ones right now. The COC is doing one for Wyoming, the entire state, and also CSBG here locally, the tripartite board is ordering a new needs assessment. And I do find them incredibly interesting. I really look forward to when the new ones come out. I think they're great. And I just did one today, actually. I just completed a survey for a needs assessment for Head Start. So I'm sure that when they collect all of their data, and it was just a short survey, but needless to say, it's still it's still a needs assessment. And I always really look forward to those numbers being published to see if anything one has changed from the last needs assessment to the newest one, because usually it's a couple, maybe 2-3 years since the last one. And historically, just based on my opinion, not a lot changes, right? I mean, the main top needs are still the main top needs. But it's always interesting to look at them. I mean, I love looking at survey results anyway. Just one of my weird little quirks. And I do think it's really interesting. But also I think it's really sad that the things that came up on needs assessments 5 years ago and then 3 years ago and now are probably going to be the same things that come up on this one. And I'm not sure how to address those main needs, right? I mean, not all of them are even in our wheelhouse, but some of them are. And we just keep showing, okay, we have this need, we have this need, we have this need, but is it effectively being met? And I'm going to kind of go out on a limb and say, hopefully on these new needs assessment, we've moved the needle a little bit, but based on what we see on a daily basis, I'm going to say the main needs that we see, the top needs, have not changed.
Sherry, I want to thank you for that because I think that those things are really important. And our legislation, the CSBG Reauthorization Act of 1998, says we have to show change. We have been tasked with eradicating poverty. And how many of us can look at our needs assessments or our poverty indicators and say, nothing is changing. When the rubber hits the road, we're not seeing measurable change. And that, as a provider, can do a couple of different things. First of all, sometimes it makes us feel like we're just banging our head against the wall and we just keep spinning our wheels and doing the same thing over and over and over again. What's that saying? The definition of insanity is doing the same thing over and over again and expecting a different result. Right? We oftentimes see that. And I think sometimes we need to start asking ourselves different questions. Is if what we're doing right now not moving the needle, then how do we move the needle? And interestingly enough, Sherry, this is one of the things that Lindsay and I are working on right now through our Wyoming Data Project, is really teaching agencies and individuals to be more comfortable in analyzing that data, comparing and looking at comparing and contrasting. It's like, okay, what are the questions we really need to be asking myself or ourselves? And I'm just going to give you guys a really quick example. Let me look at the clock here really quick. A lot of times when we look at our needs assessment, it says housing is a need. Okay, housing is a need. That should start. That's just the very beginning of a conversation about identifying the exact need, getting down to the root of what our need is. So I challenge everyone to think about, if housing is a need in your community, is it that there's not enough housing to go around? Is it that the housing that is available is not affordable for some of the people that live there? And if it's not affordable by the people who live there, why not? Are the people that can't afford the available housing, is it because they don't have the paying jobs necessary to afford the housing that exists? Or or let me go back. If that's the case and they don't have high enough paying jobs or a living wage paying jobs to be able to afford the current inventory in that community, why not? Is it because we have too many high school dropouts? Is it because we have a low graduation rate? Is it because there aren't any jobs in our community that offer a living wage? We start asking these questions. And when we get down to it, Sherry, to your point about some of these things are out of my wheelhouse, we have to be able to recognize what our wheelhouse is, right? So let's say, for instance, we dig and we dig and we dig and we get down to the root cause that we do not have enough high-paying jobs to meet the need of individuals to afford the housing that is available. We can go back to the analogy that says we can either feed a man a fish or give them money on a monthly basis to pay their rent, or we can teach them to fish. And if we teach them to fish, or we give them opportunities to get job training or education or those things to get a higher paying job, we have to recognize, if we're trying to teach that man to fish or that woman to fish, what if there is no pond or lake in our community? What if the pond or the lake that we do have in our community is polluted and you can't fish out of it? We're now talking about community issues, community initiatives. We have to be able to identify, is this a community need or is this an individual need? And that is different for every community and every community action agency in Wyoming. That answer is not going to be the same in Goshen County as it is in Teton County. So this is what we're going to do. We are going to put together manuals that help individual agencies start asking those types of questions. How do we really address a housing issue if it's at a community level need? My agency doesn't have $14 million to put up a new low income senior housing building. So how do I use my CSBG money to impact change on the community level? And those are discussions that we all need to have. On a different level, let's look at Sheridan County. And I talk about Sheridan County a lot because that's where I'm from and that's where I provided services. For the past 10 years, transportation came up as the top issue in our community. For the first time in our most recent CNA, transportation wasn't on there anymore. And we were like, whoa, you know why it's not on there anymore? Because we addressed it at the community level. We decided as a community, transportation barriers was something that we could address at the community level. So we took CSBG dollars through our senior center and created a fixed stop transportation bus route in our community that runs every hour on the hour with stops. Everybody has access to this transportation model that can take them to grocery stores, to the college, to the VA, to the healthcare facilities. All of that's there. And for the first time, transportation fell off of our needs assessment. The danger of that is it's no longer on our needs assessment. It is no longer identified as a need in our community. That doesn't mean that we solved it. It means that we still are going to have to recognize that we have to maintain this community initiative to ensure that those individuals who need it the most have access to transportation. So that was a whole lot of in-depth. We could really go down the rabbit hole in all of that. But what I really want to talk about as we go forward, and before we go forward, I'll give you guys one more chance. If there's anything else you want to share about your experience around your community needs assessments, the next thing we're going to do is we're going to go in and we're going to show you guys where you can go find the most updated information about your community. So even if you're not having a community needs assessment done this year, there is still assessment data that you can gather to help you look at where your community is to answer the questions that we just raised. So, but before we do that, any other questions or comments from anybody in the group?
Okay, I'll speak up again if everybody's being quiet. Um, I thought it was invaluable, Susan, when we talked about housing versus, because I agree with you, everybody just says housing. And what does that mean? Because it means something different. And the fact that Sheridan has a great older senior housing setup there. And it's the younger folks, it's the younger working folks that can't afford housing, where in our community, it's the exact opposite. And I use that example all the time because housing in Sheridan looks very different than housing here, where the only two facilities that we have that are senior or disability based are in Green River. Nobody wants to live in Green River. Now, one, they're not huge complexes to begin with, but they are there. They do exist. They're great. We love them. But nobody wants to live in Green River because all the amenities are in Rock Springs and they don't have the transportation. And so, if you ask, if housing specifically for me would be more income-based housing, initially targeting seniors and the disabled here in Rock Springs, because there isn't any. And we run up against this constantly with our clients. It is a huge thing for those living on Social Security, who, and this, I guess, is the most prevalent thing. They bought a trailer 30, 40 years ago in a trailer park. And everything was great and everything was wonderful. And now they're retired and they're getting their $943 of Social Security money. And their lot rent, which used to be, $75, $100, whatever it was, way back when they bought their trailer, is now $600, $700 a month just for lot rent. They cannot afford that. One, for them to think about leaving their home that they've had for 30 years is totally devastating for them. Two, even if they get a Section 8 voucher, Section 8 vouchers don't help with lot rent unless they're buying the trailer. And if they already own the trailer, a Section 8 voucher will not help them. And they cannot afford. So you're looking at this totally compounded issue of, one, they don't want to leave their home of X amount of years. Two, they can't afford to stay there. Three, where else are they going to go? Where they can afford, because on $943 a month, which is the most common amount of Social Security we see, they can't afford rent anywhere else without either a Section 8 voucher or Rock Springs housing. And if you're a single person, getting into Rock Springs housing right now is a 3-year wait, because the 1-bedrooms are not available unless the person dies or goes into a nursing home. And that is straight from Rock Springs Housing Authority. And so we sit here going, I think the most frustrating thing is I can't even give them case management to help them solve this problem because I don't know how to solve the problem, you know? Uh,
Sherry, I think this is so common, and that is that okay, and just data. Here's a number for you. 47% of all the people that we served in the state of Wyoming in 2023 were either under the age of 16 or over the age of 65. So 47%. Those two segments of the population are not eligible for economic mobility. They, under the age of 16, they can't just go out and get another job and bring more money into the household. Under the age of 16, they don't have that ability. Conversely, on the other side of that, ages 65 and older, they're on fixed income. They can't go out and get another job to bring in more income to be able to meet the rising costs that are hhappening. So when we are talking about sharing our story, back to what Lindsay was talking about, that narrative can be 47 this is your answer to people is like they can just go get another job. For 47% of the people we served in Wyoming, that's not an option for them. And so we have to look differently at how we're going to be able to provide resources to that, right? We don't have the money. And Sherry, I know how much money of CSBG you get. You don't have the money to be able to go and pay rent for people for an indefinite amount of time for the entire year. That
for
is just not
47%. No, for 47%. And you're right. We
you
don't.
can't do it,
We
right?
keep cutting and we keep cutting and we keep cutting. Because we have to based on our funding, you know. We want to help everybody and we got in the habit of being more generous during COVID. Which was bad for everybody. It was bad for me. It was bad for staff. It was bad for the people of the community because money was abundant. And I don't mean bad. I mean, yeah, it was a lot of fun. I mean, it was great. It was great to help everybody. It was great to help them with their whole entire need, not just a portion of it. But it also created a lot of problems. And we can't keep that level of assistance. I mean, there's no way. I mean, yeah, that is not happening now. And people got used to getting all of their needs met. And so that decreased their, I don't know, maybe their drive to go out and be self-sufficient because they didn't have to. And I mean, hey, if I was getting free money every month, would I drag my butt in here to work every day?
Right. No,
Probably
and
not.
think,
I mean,
right. And let's bring that back to the community needs assessment. How do we know those things are happening, right? We can go through our community needs assessment and say, when we dumped a whole bunch of CARES Act money and a whole bunch of emergency rental assistance program money into our community, yeah, we were able to temporarily bridge a gap. But what happened is it drove rents up higher. It
yep,
drove a lot of
yep.
things happened that there were a lot of unintended consequences. And those are things that we can track over time with our data. So Sherry, I hate to cut you off because
No,
I could
cut
talk
me
to
off.
you.
We got to get through with this training. It's
Yeah,
all good.
I mean, I could talk to you about this all day long. And this is part of what Lindsay and I are going to do through CSNO and to our members of CSNO is let's take this analysis and let's start asking questions. What can we do with the available resources that are available to us, right? So I'm going to move on really quick because the next thing that we do really want to talk about is if we need to get immediate information, where are we going to go get that from? And that is on a couple of different places. Let's start with the closest assessment, and this is the one at your fingertips. If yours is more than 3 years old, then it's probably not accurate anymore. Time traveled real fast after COVID, so most of the data in your community needs assessment is not as accurate as you would wish it was. That's just a fact of life. Traditionally, historically, we could accurately guess using historical trends what the current situation is going to be or what it's going to look like. That's no longer the case. We don't get to do that anymore. Some of you do have community needs assessment from your office that are available for you to take a look at. Lindsay went ahead, and I'm going to stop sharing really quick because I'm going to click on a link and I'm going to open up that link in another place so you can see what we did. So I got to find it again. I just lost it. In our needs assessment, we provided you guys with a one pager. This one pager, and I'm just going to drag it over, be patient with me here really, really quick as I have to reshare everything here. The one pagers that we put together for you are giving you the most updated information that we have. Lindsay, do you see our website as the shared page?
Yeah.
Okay. So when you go to our website, you can come over to resources where your community needs assessments are. And if you scroll down, Lindsay went and took 2024 data for every county in the state of Wyoming. So since we've got Sherry on the line and Sherry has been so active, we're going to take a look at her one pager. When we click on that, that's going to bring up some information that is the most currently available for Sweetwater County. We know your population is 42,000. You have a population density of 4 people per square mile. We know that your top needs identified in your CNA were your cost of living and inflation, employment and low wages, and housing. We have a QR code here for you to click on that you can go look at your living wage calculator, which we're going to take a look at later. But this is just that one pager that's going to be able to help you say, hey, this is what our total population looks like, and this is what our population is by gender. Very short, very sweet, to the point. The click here button that you see here at the bottom is going to take you to another report. This report is something I'm going to show you guys how to pull for yourself out of a certain website. Something to keep in mind. The report that you see here is from the most recent American Community Survey, or the ACS. Did I say that right, Lindsay, this time? I always get it wrong. This report is the most updated information we had at the time. But what you can learn from this is that in February, this is going to be updated to the 2023 data. So this will be the most that we can do. But if you click on that here link, it's going to take you to an in-depth, as you can see, 72-page report talking about separate demographic and poverty indicators that you're going to want to know, not only for your county, but as it compares to the rest of the state and for the rest of the country. So you're going to know who's living in your community. In this particular instance, we're seeing the population that identifies as Hispanic or Latino in in Sweetwater County is 6,800 people. 16% of your population identifies as Hispanic or Latino. That's going to make a difference if you're looking at, do I need to start providing Spanish, or do I need to start providing materials in a second language? All these demographics are here for you to look at. I'm not going to spend a whole lot of time on this particular report because each one of you will be able to go back and look at your report. So just as a reminder, you can go back to our website, scroll down, click on your own report. I'm going to show you later in this session how to go pull your own report here really quickly. The other place you can go is looking at other existing community needs assessments that might be existing in your community. In our case, this was a community health needs assessment done by Sheridan County Hospital that allows us to go take a look at what their data was. What do they have to say about information that they learned from their needs assessment? You can steal information from them and get information about that. You can also go directly to the ACS or the Census Bureau. And when we go to the Census Bureau, it's going to take you to a page called the American Community Survey Data. You can go to the Census Bureau and start looking at selected social characteristics, economic characteristics. This is the most updated information that we have available to you. It is an amazing place for you to be able to go look at some different things. We also are going to offer you, and let me just clarify this by saying I'm going to send out this slide deck for you so you have access to all of these links as we go through. We're going to take a look at the living wage calculator from MIT. Let's go into, I saw Crystal in the group, let's go into Natrona County. And we now know if you are two adults with one adult working and you have two children, your household needs to be making $38.97 an hour to be considered to have a living wage. What does that mean? Well, it's going to tell you that if you are living in Wyoming in Natrona County and you have two children or one children or whatever it is, you're going to spend approximately $7,500 a year on food. You're going to have medical expenses, housing, transportation, internet, mobile. These are all the expenses that you would need to cover as a completely self-sufficient household. If you are not making $38.97 an hour, you need to be if you're making $15 an hour or less, you're considered to be living in poverty. This is what it looks like. So when we see these help wanted jobs or the help wanted ads that come out there and they're like paying $14 an hour, that is a poverty level wage where your family is going to be qualified for SNAP benefits, low income or free and reduced lunches, all of that. This is information that we're going to go through. You can take a look at. If you get to a point where you're like, I just don't think those numbers are accurate, you can go ahead and go to the Wyoming Women's Foundation and input your own numbers for the community that you're living in if you think these numbers are incorrect. The second to last one that we're going to take a look at real quick is the State of Wyoming Economic Index. This is the Economic Analysis Division, and the most current information we have about living in Wyoming is the Wyoming Cost of Living Index for the second quarter of 2024. So this is going to be April through June. And when you click on that link, it is going to tell you what community, let me get this bigger so you guys can see this, what the cost of living is in the state of Wyoming. We know Teton County, most expensive place to live. If you are at 100, Sheridan is the fourth most expensive county to live in. Lincoln, Sublette, Sheridan, and Teton. Those are the most expensive places to live. 100, as you go through the report, you'll be able to track trends. Look at this, quarter one of 21, 22, and 23. Look what happened to the cost of living. This is what inflation looks like in a community. 27, 28, 29, these ones right down here. That was the collapse that we had, the housing collapse. This is going to talk to you about what these costs of living look like in your community. And finally, and this is where we're going to spend a little bit more time, is in the National Community Action Partnership Data Room. This is a data hub that is available to all of you. All you have to do is go in and register for this. Again, I'm going to get these links to you. I'm also going to provide you, I'm actually going to do this in the chat right now. Let me do this in the chat right now. I have the directions for you to follow along with this. I have a PDF that I just uploaded to the chat. So as we come here, you can come in and register. You are going to find your data. You can do a housing assessment. You can also do a community needs assessment. I'm just going to let you know now your housing assessment is dated. This is incredibly dated. The most updated information we have is from the WCDA needs assessment around housing. They just released those information. That's where I would go. We're going to explore what the community needs assessment looks like. Sorry. I have to log in here really quick. I'm going to walk you through it really, really fast. Okay. Get to my needs assessment. I can map my community. This is a map room where you can get different layers of data that are overlapping on your county, so you can get that information. We're going to go to the community needs assessment. As we go into the as we go into the community needs assessment, we're going to select our state, Wyoming. We're going to collect what county we want to work on. So let's collect Converse and Natrona County. We're going to add those over to our report location. We are going to look at our different indicators now. As we look at these different indicators, you can look at population, income, employment, education, housing, other social and economic factors, behaviors around health, healthcare access, health outcomes, and then special topics around COVID-19. When you select what data indicator you want to take a look at, you can pick and choose which one of these you want to select. So for instance, we're interested in knowing what is our incarceration rate in those two communities, because we, in our needs assessment, I'm just making this up, it indicated that there was a huge incarcerated population that we needed to look at. So one of the things that you can do is select that one. Or maybe we want to know what our population is under the age of 18. Or we want to know what our veterans, our age and gender demographics look like. Or we can select them all. If we were to select them all, you would get an indicator on each one of those. So in this particular instance, just to make this smaller for ourselves, we're going to click on our urban and rural population. We want to know what the income levels are for those are in our community, and we want to know how many households are in poverty. We want to come down here and we want to know how many of our individuals are experiencing poor mental health or substance abuse issues. So we're going to click on that, and we're going to click on our report. Now, when we get our report, we can click to different segments on here, but I wanted to show you really quickly what this report's going to look like. First of all, our report location is the combined information from Converse and Natrona County. We can also look at Converse and Natrona County individually and look to see what's our population breakout as far as urban population and dense and rural population. If you want to know where this information came from, you're going to come here to your data source where you can show more details. This is where we found the methodology. This is how we found out where this information was coming from. If we look at this, we're looking at 2020 information. Fine for rural and urban, not great if you're looking for immediate housing. You continue down through this group, it's going to break this all out for you. What is our rural population breakout by age? What is our rural population breakout by race alone, or our percentages of? And then we're also going to want to take a look at what our veteran population is. So this is what we're learning about our veteran population. We know in Converse County, about 10% of our population is made up of veterans. So this is how this works. This is how you kind of go through all of these things. You can find out more information, click on the totals as you're going through here, find out where the information was gathered from, and you can also come over here and jump to different segments. So if we wanted to take a look at what our indicators were, we're going to look at, oh, there's a lot of data in there. Just go ahead and take a look at all of that. So why am I showing this to all of you, right? We're sharing this with you because we need to understand where we're going to go get all this information in the future. As we look at the ability to learn more about it. We can find out deeper information as we go. I put the MIT Living Calculator here and the data room information here so you can go find it. And then finally, who do we need to share this information with? Well, we need to tell our board of directors. We need to tell our senior leadership. We need to talk to our community partners, because if it's not something we can address in our agency, maybe we can find a community partner that can. We want to share this information with our community members to create buy-in for the program and the services that we're offering. We want to talk it to our local funders and our supporters, and we want to tell our elected officials, this is what's real. This is what's happening in our communities. So that's what we have today. We had a great discussion. Thank you guys all so very much for participating. I look forward to working with you on all of this. Each one of you has an opportunity to reach out to Lindsay or myself to help you collect this data if you're struggling with it, help you interpret some of this data, and what to do with this data in your agency once you've collected it. Before we go, does anybody have any questions or comments or pushback about the information we covered today?
And
All
just
right,
really
here.
quick,
Oh, yeah.
sorry, the attachment that you put in the chat, I think might be an outdated presentation PowerPoint instead of the PDF. So you might just want to re-add that, or we can email it out afterward, whatever is easiest.
You guys, I'm sorry. Did I send the PowerPoint? I thought I did. I did. I'm so sorry. I attached the wrong document. Ignore that document. I am going to have, we'll send out the directions on how to do what I just did in the National Community Action Partnership data room. I will send out the instructions to everybody on how to do that. Lindsay, can you also include that in your case management cohort that you have coming up so they can take a look at that? We'll share that as often as we can. In the meantime, when we close this down, a survey is going to pop up. If you could please take a really brief a moment to fill out that survey. Let us know what you thought about the training and how we can help you in the future. Sure would appreciate it. Thank you all again very, very much. Do not hesitate to reach out to Lindsay and I about how we can help you collect assessment data around your community. Have a great day out there.